So this is just in a glimpse a bit of the idea of the situation here in Quebec. So you can see the number of cases as of April 5, where currently the province in Canada where there's the most cases. Our first COVID cases happened February 27, and then the measure was started on March 12 with an increase in implementation of social distancing measure up to March 28, where there's almost a lockdown of everything. It was supposed to end on April 13, but it was prolonged till May 4. So if you move to the next cases, I wanted to first start with managing infodemic and starting with what is working well currently in Quebec. So there's a great collaboration between public health scientists and the government to inform action. So there were teams that rapidly started to do active surveillance of cases, the number of people in hospital, ICU, etc. There was also a team that quickly developed guidelines for emerging concerns and questions. There also, we're doing regular survey to monitor the public attitudes toward the disease and behavior. So daily survey looking at whether people apply the social distancing measure or not. There's a clear and very transparent communication by authorities in Quebec. So each day there's a daily press conference where the number of cases and the epidemiological situation in Quebec is presented. They also set up a telephone line dedicated to COVID-19 with healthcare worker answering the public questions and concerns about the disease, including increased anxiety and mental health issues. And there's also an email for the public, but also for public health professional and healthcare worker to ask questions, and they receive responses. And when there's frequent questions, these questions and the answer are put on the government web pages. Up till now, we see also a good positive coverage by the press. Most information is evidence-based and is relying the public health measure. And there's been no politicization of the discourses in traditional media around COVID-19. So if you move to the next slide, these are data that were developed by Google using mobility data, and we can see that this is for Quebec. We can see that there's an important drop in people going to groceries, park, using public transportation, and this is also reflected in the regular survey that we're doing. So there's a great adherence to public health recommendation as of now. If you move to the next slide. But there's also some issues, as was mentioned by Yana. We're seeing an unprecedented increase in fake news to a level where people doing fact checks and myth busting in Quebec say that it's impossible to debunk all those fake news one by one, and they're doing an approach where only the fake news that could have a negative impact on people's adherence to the measure or on people else are debunked, and all those other measures are not. So as was mentioned in Yana's presentation, many of the fake news have not much of an issue. In Quebec, we see that there was a decrease in gas price, shortage of food and other product, the toilet paper shortage happened also in Quebec, but there were much more dangerous fake news regarding treatments, diagnostic and prevention approach against fake news. We're also seeing an emergence of conspiracy theories in Quebec. So this idea that the virus was created in a lab, in the Winnipeg lab, the Canadian Public Health Lab, that the pandemic is a plot against Donald Trump or a conspiracy by medical elites to sell more vaccine. one of the popular person in Quebec that is sharing those conspiracy theory. His name is Alexis Cossette-Trudel, and we've seen that his reach and his audience increased fivefold since the beginning of the crisis in Quebec. And the fact that social media remove those posts in fact reinforce their credibility, because people tend to say, go look at this video before it's removed because the government is hiding something. So there's an issue there. If you move on next slide. So another challenge is because we have news 24/7, in addition to a lot of well-intended communication from different groups, researchers, civil society organization, it generates a lot of ambiguity and confusion about which approach is recommended or not. Canada is a federal country, so health is under the responsibility of each provinces. So their measures that are implemented in Quebec may not reflect the measures that are implemented in other provinces. And there's a lot of confusion around specific things, including should we wear a mask or not. So mask is recommended in other provinces, but not in Quebec. There's also a lot of questions with different information, and that's beginning to be a problem. People the measure in the social distancing measure in Quebec are quite important, but not the same as were in the US or in other provinces, and that make people questioning those approach. If you move to the next slide. Finally, I think if we think medium long term, we're already seeing in our regular survey an important increase in anxiety and psychological distress in the population. And it's been 3 weeks of social distancing measure. We expect these measures to be in place for a medium to long, a couple of weeks again. So there's this challenge of how we will be dealing with mental health issue while people are quarantined. There's also some issues around informing the hard to reach. It's not everyone that's looking at the traditional media, and there's some group that are using other source of information, a younger generation that might not be well informed, newcomers that might turn to the media in their country of origin. And there's also all these issues around communicating uncertainties and changing guidelines. We're preparing for the next phase and the removal of some social distancing measure, but it won't be back to business as usual. So how this changing guidelines will be communicated is a challenge we anticipate. And to end the presentation, I wanted to show you the rainbow. It's begun to be a symbol of resiliency in Quebec, and with the slogan "Ça va bien aller" or "everything will be fine." Thanks.